So in college, you may go to a four-year college, graduate with a four-year degree. You'll have a couple prerequisites that you need to meet for the physical therapy program. Typically, you graduate with a bachelor's degree. You've taken all the required courses, which is usually some chemistry, some math, some biology, some kinesiology, and lots of movement studies courses. And then you apply for graduate school. So right now, physical therapy school is 2.5 to 3 years. It is a doctorate program. So once you graduate physical therapy school, you are a doctor of physical therapy. During school, physical therapy school, you have a whole bunch of courses. You learn some of the basics. You learn anatomy. You go through and you learn different hands-on techniques that you practice on your classmates. You learn about all the different areas. You learn about orthopedics. You learn about neurology. You learn about pediatrics. You go into the hospital setting. You go into the nursing home setting. And then throughout your schooling, you also do clinical rotations. So you end up in all these settings practicing the skills that you've learned. One of the things that you can do between college and graduate school is there is a couple programs in the US that do a kind of a combination program. So instead of, 6.5 to 7 years of school, it ends up being just 6 years. So 3 years of undergrad, 3 years of PT school. That middle year, or the fourth year of undergrad and the first year of PT school is kind of a combo year. Then you come out with one less year of school and still with a doctorate degree. Regardless of which route you take, whether it's college and then PT school or the combination, you still need to pass your physical therapy board exam and apply for a state license. So it's a 6-hour written exam, 250 questions to test your skills on every part of physical therapy. So lots of studying before it. As soon as you pass your exam, you can apply for your state license. So you are licensed to practice in each state you apply for. If you're going to work in Wisconsin, but you went to school in Illinois, you can apply for either license or both of them. So when I came out of school, I went to school in Illinois. I came out of school with an Illinois license, applied for that one. I did not initially apply for my Wisconsin license. So if you want to move states, then you can apply for a license in a different state without having to pass another exam. The nice thing in the physical therapy world is once you pass the exam once, you do not need to pass it again. Okay. If you like taking tests, there are other specialties that you can go into to take more tests and to get more letters behind your name. Orthopedics, sports, neurology, pediatrics, and women's health are all different specialties in physical therapy that you can do more coursework and become really a specialist in those areas. So once you become a therapist, you are not done with the school if you don't want to be. You can continue to learn if you want to keep learning. That being said, you do have to do continuing education to keep your license current. So every 2 years, you're required to do 30 hours of continuing education in whatever area you'd like to make sure that you stay on top of all the new research, right? We don't want a physical therapist that's been a therapist for 30 years and hasn't looked at anything new that's come out in 30 years, because a lot changes in 30 years. Now, if you are looking to be a physical therapist and you would like to stay in state, here are some of your schools in Wisconsin. So La Crosse has a program, Marquette has a program, Carroll has a 3+3 program, so that's that combination program I talked about. UW-Milwaukee, UW-Madison both have programs. Concordia has a program. Stevens Point just started their program this year, and they'll graduate their first class in 2024, I believe. And then Belling College in Green Bay has a hybrid program, so part online, part in person. So as you can see here, the schools, some are private, some are public. Just like undergraduate, private universities are typically a little bit more expensive. Public schools are a little less expensive. There are also, as you can kind of see on the map, schools that are outside of Wisconsin that are still awfully close. And there's a lot of programs all over the country. So if you wanted to go to school in California, you could go to school in California. It doesn't matter what state you go to school in and what state you want to practice in, because everybody learns the same core education. So like I mentioned, there's cost difference. in-state education is typically somewhere between $65,000 and $90,000. Now, this is in addition to your undergraduate degree too. Out-of-state or private education is typically greater than $100,000, and this is just talking tuition, not housing and food costs. So it sounds like a lot, but it's really an investment into education in your future, right? I don't feel like the cost of education outweighs the, my joy of the job. It is expensive, but it's totally worth it. All right, thanks for listening. What do you guys have for questions for me?
I was just gonna ask, like, if you were to not pass the test, like you have to take it again, obviously.
Yeah,
so
you have
would
to take it again.
Pay for it?
Yes, yeah, so each time you sit for the test, you have to pay for it. I believe the test is about $500. Yeah. Yeah. So you study really hard, so you, yeah. What other questions do you have? Yeah.
Do you experience a lot of frustration from the patients, or what kind of attitude do you usually?
That's a really good question. So I guess it's all over the place. There are some patients that are really happy to see me. I would say most patients are pretty happy to see me in the outpatient setting. Now, in the hospital setting or nursing home setting, that isn't always the case. Sometimes, somebody just went through a traumatic injury and all of a sudden I walk into the room, hey, I'm from physical therapy. And they're like, nope, not today. So sometimes they don't want to see me. It happens in the outpatient world as well. Somebody's in a lot of pain, sometimes they don't want to move because it hurts. But I think the best thing you can do is educate the patient. Say, I understand you're in a lot of pain, or I understand you just had this tragic event, but it's important that we move because we want to get you back to doing what you want to do, whether it be, walking your dog or riding a bicycle. And I feel like typically if I can talk to the patient a little bit, educate them on why we're doing it, let them know hey, I'm not here to make you more miserable. Even though you think I am, I'm really not. They usually are pretty good about, okay, let's try something. You will have the occasional patient that is just like, nope, I'm not doing it. And then you try again later, try the next day, and go from there. What else? Other questions for me?
This whole concept has changed so much too, as I can look back to my first surgery,
Yeah.
10 years ago, 40 years ago. You're laying in bed for days. I mean, now you get your knee replaced within hours. I'm up walking down the bed.
Exactly. Yeah, so one of the big things, like you were saying, this change is, we know through research that movement is good. Even those patients that think they can't move, they can move in some way.
That's what they call it physical.
Exactly. In the hospital settings, there will be patients on ventilators that we get up and get walking. So you're walking down the hallway with the ventilator, and the more we can move them, the better. Yeah.
So, do you have a slide of your information on there?
Is that all you need, or you need
And
more?
it's bone and joint,
Yeah.
5200 Hummingbird.
Well, they just updated their
Oh,
address.
yeah.
It's 52 and 4 zeros after. Yeah. I think it's 552 with 4 zeros. I don't know. Regardless. What other questions do you guys have? Yeah.
Well, what kind of benefits does your employer provide?
So health insurance, dental insurance, vision insurance, 401k match, options for additional life insurance. Actually, I think we have a pet insurance that you can get, but pretty much any of your standard benefits. Yeah.
Do you know how much time off you can expect in a year?
So as a new therapist, you get 5.2 hours that you accrue each paycheck. So, and paychecks are every 2 weeks. So 5.2 hours every 2 weeks comes up to about 3 weeks a year of PTO. Yeah, pretty good. Unless you're being used all the time. All right, what other questions do you guys have? Nothing? All right. Thank you for listening and putting up with me. If you didn't get candy, you can go